I'm Simon Wade. I'm a student of physical therapy. Matt, do I have permission to touch and locate some structures on you and take a video today? Perfect. Thank you. So we're going to be palpating some structures on his lower back lumbar area. First thing I'm going to do is I'm going to locate the patient's iliac crest. From here on either side, that takes me into about the level of L4, where I can find my spinous process here. I can feel interspinous spaces on either side. So interspinous space, and then L3, interspinous space, L2, and L1. Another way that I can locate L1 is I can basically find the patient's 12th rib and bring that in to T12, and I would come to one down from there, find myself on L1 again. Next, I'm going to locate the transverse process. I will do L3 here because this is an easier one to find. So if I come down to L2, down to L3 again, I'm going to go lateral to the Erector Spinae and push in here, pushing towards medial, and I can feel transverse process. If I come back to my spinous process where I was, and I go a little bit less lateral, and I find myself pushing into the side there, I can feel the lamina groove in there, deep to the Erector Spinae. Next, I'm going to palpate L5 facet, because although we can feel the transverse process of L1 through L4, L5 is going to be slightly hidden behind the iliac crest. So if I come back in, locate L4 again, and then I come one down from there, I'm basically going to draw myself a line between that spinous process at L5 and the PSIS here behind the dimple. If I go deep to this in here, I can feel the facet joint deep in there. Next, I'm going to palpate the Erector Spinae as a group here in the lumbar area. These run vertical, so I'm going to palpate across the fibers. And then to feel those muscles contract while I have my hand palpating them, I'm going to ask the patient to lift one of his legs in the air, please. Good. Some hip extension causes the lower back to stabilize, so I can feel those muscles firing. Next, I'm going to palpate the QL, or Quadratus Lumborum. First, I'll want to locate the iliac crest here. And this muscle is going to go from the iliac crest to the 12th rib. And so if I palpate, I'll do it on this side here. Technically, I should be on a ipsilateral side for patient privacy, but for the camera to see, I will palpate contralateral here. And so Matt, can I have you lift your hip towards your ear? Like hip height for me on the right side? Perfect. And then relax. And he's activating his QL when I do that. And then the very last thing, Matt, I will have you roll over onto your back for me, please. Now I'm going to palpate the abdominal aorta. I'm going to go just superior to the umbilicus here. It's going to be just left of center, but almost centered. And if I palpate deep in here, I can feel that pulse. Very strong. Thank you.